AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, my friends from Florida, and I want to wish all of my Jewish friends a happy Passover. And my Christian friends, may you have a happy Easter. Tonight we have a special guest who's been on with us a couple of times, but we get a little bit of history of this gentleman. I like to classify him as an old-fashioned doctor with new ideas, with great ideas, but one that takes a lot of time with his patients. His name is Dr. George Botello. George now came to Boca, how many years ago, George?
Well, I've been in Boca now a good 15 years.
Tell us a little bit about history, about how you became a doctor and why you became a doctor and what's your specialty.
Okay. I actually became a doctor in 1986. I always wanted to be a doctor, and nobody can tell me why, but I started wanting to be a doctor when I was a child. I believe it was one Christmas when I got a doctor's kit, and that's when it all began. We had no doctors in the family. We had no knowledge of any doctors within our family, but somehow I chose that profession relatively early. So I pursued that, and it kind of hit home when I was in 8th grade, and my English teacher, Mrs. Joanne Myers, who has long since passed, she went around the classroom and she asked what everybody wanted to be. And she came to me and I said I wanted to be a doctor. And she said if I wanted to be a doctor, then I should go to Johns Hopkins University. So that became my dream, and ultimately I did get accepted to Johns Hopkins University. Following that, I went to medical school at Rutgers Medical back in New Jersey. I did my training there until 1993, and then I relocated down to Florida, interestingly all the way down to the Florida Keys, where I still maintain a very limited but part-time practice. Now I'm up here in Boca almost full-time. And this is where I've been for a good 15 or so years.
Well, Doc, you have a very interesting story, and it's on YouTube. So if they want to watch it on YouTube, they can go to your website and go to YouTube.
Sure can.
And what is your website, Doc?
My website is injurymd@gmail.com.
Repeat that again.
injurymd@gmail.com.
And your phone number again at your office?
We have several, but the local one is 561-483-4111.
Give me it again, please.
561-483-4111.
Why we're happy to have Dr. Botello on is because he specializes in orthopedic surgery.
I do.
And he has a knowledge, and he'll define what really we've had a lot of orthopedic doctors on, but they never really told us what orthopedic surgery is. So I'm going to have Dr. Botello give us his classification of what orthopedic physician is, if I said that correctly.
You did. An orthopedic surgeon is actually an orthopedic physician first, and everybody should realize that. When people come into our office, they're not undergoing surgery, they're undergoing an orthopedic evaluation. And then we have to decide whether or not they may benefit from surgery, but most of my practice is non-surgical. Probably 80 to 85% of my practice is non-surgical. So most of my patients do not undergo surgery. Although down the road, when they start getting older or they get injured, you never know if they would need surgery in the future. Orthopedic surgeons, we're in the field of medicine, but we practice and treat patients predominantly with orthopedic injuries. That is, injuries related to bone, muscle, tendon, and in many cases nerve as well. I also do spinal surgery, and I operate on nerves as well. So we treat people who are injured, and they could be injured anywhere from a mild sprain to a broken bone, including broken femurs or even massive trauma in motor vehicular accidents or major falls where they could have multiple fractures and other injuries as well. And in my particular practice, I treat everything for all intents and purposes from the base of the skull all the way down to the toes. So I do arthroscopic surgery, which is less invasive, to injections of the spine for pain control, to spinal surgery, to joint replacements of the hip and the knee, to hand surgery with tendons and carpal tunnel. So I run the gamut.
And you just went through recertification, am I correct?
I did. I recertified. I'm board certified in orthopedic surgery. I certified in 2017, and I'm certified now until the year 2029.
Well, what does that mean to get recertified for your practice that you've already spent years doing?
What happens is, in the field of medicine, we have a standard by which they measure us, and that standard actually begins when we're in medical training. While I was an orthopedic surgeon, I had to go through a program that was accredited by the American Board of Orthopedic Surgeons. That accreditation only went so far because I had to be recommended to take my boards by the chairman of our department, as well as I had to be recommended by some of my peers. So upon being recommended, once the board accepts you after completing a residency program, they entitle you to sit to your written board exam, which is phase 1. So upon passing phase 1, then they actually follow you, and you have to go back about, I believe it was 12 to 18 months later, where we had to give a list of our cases that we did over the course of a year, and they would check those cases, and then they would test us on those verbally for, I believe it was almost 3 hours, at least 2.5 to 3 hours. And then once you pass your oral boards, which is one of the harder things to pass, you become board certified. So upon your board certification, then they created something called maintenance of certification. So every 10 years, we have to recertify and make sure that we fulfill a certain set of requirements, and we remain within the standard. And that's what it means to be board certified, or in my case, recertified.
So if you don't do that, you're still considered board certified?
No, you're still a practicing surgeon, but nowadays people look at that board certification as a certain level of standard, a certain level of competence. And I do believe that a lot of insurers and insurance companies are actually looking at those records, and they're probably basing their reimbursement on whether or not we are board certified.
And that means that you may accept more, you accept most insurances?
We accept a number of insurances, including Medicare, a number of private insurances, but we don't accept all.
Okay. So when they call you, you will find out whether you accept that insurance or not.
Correct. We had a patient today who called up, and we found out that we were not within their network, and we recommended other people within their network.
Wonderful. One of the things that we did talk about while we're outside, Doc, discussing things, I was discussing somebody that has a torn meniscus. That's me. I have 2 torn meniscus. And I said, Doc, I've gone through stem cell, I've gone through gel shots, I've gone through cortisone shots, et cetera, but I didn't do surgery because maybe I'm afraid of doing surgery. And you recommended you could possibly do arthroscopic surgery.
Correct.
And tell us what arthroscopic surgery is instead of doing a complete knee replacement, which is going to tie you up for a long time. You said to me that I could stop playing golf within a week if you did
That's
arthroscopic
correct.
surgery. So explain arthroscopic surgery. What's the difference between that and regular general surgery?
Well, we have something called arthroscopic surgery. In the field of general surgery, they actually call it endoscopic or even laparoscopic when it's done on the abdomen. But arthroscopic surgery is surgery that is done in an indirect fashion, in a minimally invasive fashion, using cameras and lenses, very small lenses that measure about 4 to 5 millimeters in diameter. And the instruments are also quite small. So what we're able to do is make 2 small or 3 small incisions. We're able to look at everything within the knee on a television screen, and we're able to repair and reconstruct things within joints, whether it be wrists, shoulders, knees. The most common are knees and shoulders, where we're able to reconstruct things and repair things, including actually suturing things together and passing those sutures and the knots inside the joint through tiny little small ports.
And one of the things you told me that, along with that, you would also do some form of stem cell replacement, correct?
In certain cases, stem cells are better, but in other cases, platelet-rich plasma is better as well. They're 2 very different things. Stem cells are actually using a certain type of cell. The cell must be a living cell, and it has to be actually what we call a mesenchymal cell. It's almost like an infant cell that doesn't know what to do yet.
And that's like the embryonic cell.
That's correct. That is a mesenchymal cell, and that is what we call stem cells. Platelet-rich plasma is actually using a person's plasma and the elements of the plasma, but it's largely not cellular. It's not involving cells. It's mostly involving proteins, but certain proteins that are important for mediating inflammation or actually mediating anti-inflammatory properties. So they do really have different applications, and it depends what the underlying problem is. Stem cells, we think, are going to work great in regenerating nerves. That already has been shown, it's not used here in the United States for this, but it has been shown to actually grow actual cardiac tissue that is able to pulsate. When they actually grew it in the milieu or the atmosphere of beating cells, they actually developed into beating heart cells.
So I'm going to take a little break here, Doc, 30-second break.
Sure.
Because this is very interesting. We're going to come right back, okay?
Of course.
Thank you.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do. Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need. And he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. To You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, and Doc, we're going to continue that conversation about PRP. And define PRP like basically it's a form of recycling the blood.
In a sense,
Spinning the blood?
it does. It does require spinning the blood and then doing certain types of filtration to the blood. What PRP stands for is platelet-rich plasma. And platelet-rich plasma is derived from the patient themselves. It's not derived from any other source. We take the person's blood through just a plain old IV site, intravenous site. We take their blood, and then we centrifuge it down. And what the centrifuge actually does is it pulls out the cellular elements, the cells within the plasma itself, and we're left with the plasma. And then the plasma itself has a platelet-rich and a platelet-poor component, and along with that, you can actually define it further. Platelets are very, very important mediators of healing and inflammation. In addition, there's something called leukocyte-rich and leukocyte-poor. Leukocytes are actually inflammatory factors and infectious factors. So they fight inflammation and fight infection. They could even stimulate inflammation. So in certain situations, you want to fine-tune that plasma for the patient's needs. As an example, somebody who is healing would do very, very well with leukocyte-rich platelet PRP, or platelet-rich plasma. Other patients would probably do better with pure anti-inflammatory components, probably like yourself, where you have a lot of inflammation and arthritis going on, and that arthritis actually causes further inflammation just because cartilage is deteriorating. So in a situation like that, you would use something more like leukocyte-poor platelet-rich plasma, or you can even filter it yet further with special filters to get what they call the A2M protein, which is a very strong protein in anti-inflammation. So there's so many different ways to tailor down that platelet-rich plasma, where stem cells actually need an environment where there's blood flow. In the knee itself, as in most joints, there is no blood flow within the joint. You actually have fluid in the joint that provides nutrition, and it actually provides a bearing surface such that it becomes oily and it moves easier. So it has two components. It's a slippery surface and it's also nutrition. But that's what's normally found inside a joint. So those stem cells would not do well in that environment because there's no blood supply.
You know, funny, I talked to a guy, I said, did you ever try PRP with spinning their blood? He said, I'm 80 years old. How am I going to spin my own blood? 80 years old. I want young cells.
But we want to pull the cells out. That's the difference with PRP.
So it doesn't matter what age you are.
No, it doesn't.
So if an 80-year-old guy is getting this platelet thing that you're saying, you prefer using that better than a regular stem cell, embryonic stem cell.
Well, especially in a joint, especially in an arthritic joint. If I'm repairing something and there's going to be increased blood flow, or I want to stimulate blood flow, in those cases, maybe using stem cells would be preferable because you want to stimulate blood flow and you want to get these cells to differentiate into cells that are only going to help the healing
and when
process.
would you know that? How would you know what to use?
Well, hopefully the physician knows that.
Prior to the arthroscopic or doing the arthroscopic?
Oh, even knowing the arthroscopic, now if I'm going in to just remove a meniscus or clean out a knee joint, I'm planning on using platelet-rich plasma. If, on the other hand, I know I'm going in to reconstruct or repair a meniscus or an ACL, I'm going to absolutely use stem cells instead of PRP.
Okay.
Yep.
So now you were also doing some studies with is it a chemist, a biochemist, or somebody you
Yes.
you have on your staff?
Yeah, biochemical. He has a PhD in biochemistry and biology.
Now, has there any clinical studies been done with this PRP?
Oh yeah, there are. PRP has been utilized for so many years. PRP as well as stem cells, but stem cells are only gaining strength now, probably in the last 10 to 15 years. PRP has been around so many more years than that. They've been using it in the office for many, many years. But I think what happened was, I believe it probably was abused or overutilized, and everybody started pulling back because the results were not as good. But it still has a great indication, and still could be utilized.
So listen, if you find this an interesting conversation, because I'm really finding it interesting, because I'm the guy with the bad knees.
Yeah.
Right? And, you know, it's very hard
And we're all going to have bad knees.
It's very hard to play golf when you got bad knees, and I love to play golf, right?
I don't know anybody who came to Florida who doesn't like to play golf.
So if you would like to talk to Dr. Botello, then the phone number again is, may I give it, Doc? It's 561-483-4111. That's 561-483-4111. And now, are you open during this COVID time? Tell me, what has happened for your practice during this COVID period?
It's been certainly a trying time for the medical practices as well as for everyone.
Even me.
Everyone.
Our business is way down, but now it's coming back. It seems like it's coming back now.
We're experiencing the same thing. A lot of people were quite hesitant. We didn't know what this virus was going to do. We didn't know what its implications were. We didn't know how it was going to impact each of us. We all have friends and family members who have contracted COVID, and hopefully, everyone has had good stories and how people have survived, but a lot of people have succumbed to this.
So your office is pretty safe to come to. You don't have many people sitting in your family.
We don't. We never have been a volume practice ever, and now we're actually even more cautious at making sure that we never have more than 2 or 3 people in our waiting room at any time.
Well, what it sounds like is that you're a concierge physician without charging a concierge
In
prices.
a sense, yeah.
You're like a one-on-one doctor, an old-fashioned doctor.
I'm not. I am an old-fashioned doctor. That's definitely true. My father would love to hear that.
And tell me what you think an old-fashioned doctor should have to do.
An old-fashioned doctor should just have to take care of his patients. That's
What-
it. Just listen, take
Isn't
care
that
of them,
great to
and
hear,
make them
folks?
better.
Isn't that great to hear that you got somebody who's going to talk to you after the surgery, during the surgery, and he's going to stay in touch with you? And I understand your practice is almost like a family practice.
It is. If there is such a thing as a family orthopedic practice, I had a patient today who, the last time she was here in my office, I actually discussed with her some of her medications related to diabetes because her diabetes was not well controlled. She's not particularly compliant, but she trusts us in the office, so we spent a lot of time the last time. And today she comes in, her blood pressure and her diabetes are better controlled. Yes, she's getting to see her medical doctor. He has a large say in it, but she's allowing us to actually lend a hand as well. And we try to do that. Recently I diagnosed somebody with rheumatoid arthritis. I'm not a rheumatologist, but he came in, had this new onset. I had been treating him for his knees, and I diagnosed him with new onset rheumatoid arthritis and getting him a specialist to take care of
I
him.
remember you saying, or listening to your YouTube video, you had a gentleman that you were doing a reconstructive on his shoulder, and he had a ligament problem when he was in high school.
Yep.
And no one found it.
Yep.
Explain what happened there.
Now, what happened was, everybody thinks of the MRI as the end-all test, but the MRI is very non-specific for certain things. This gentleman had a labral tear, a ligament tear within the shoulder, and the MRI does not identify it well. And this gentleman had recurrent subluxation, or the joint was sliding out, and he was unable to do certain things. And one of his big things was to play ball. And it ended up being a very easy diagnosis to make when you coupled the clinical findings with the diagnostic findings. We scoped him and we reconstructed his labrum arthroscopically, and he did extraordinarily well. And he went back to
you
doing
basically read the MRI or the
myself.
all yourself.
I look at the MRIs. I don't like reports because I'm trusting somebody else to make the diagnosis. But that's my job. I'm supposed to be making the diagnosis. The MRI or the x-rays are supposed to be confirming it. Okay? It's not a tool that makes the diagnosis. It's a tool that's used to confirm the diagnosis.
So you just don't take what that fellow writes.
I don't like to.
So you basically review it yourself.
Always. Yeah, we want to see the MRIs. We want to see the x-rays rather than just accepting a report.
Okay, and that's how you healed this gentleman. You found out that you realized after asking him a number of questions that he had more than just a
That's
collarbone,
correct.
right?
That's correct. And you just had to figure it out. You had to spend some time to figure it out. And once you figured it out, the treatment is easy.
Well, again, it's a pleasure talking to this gentleman. And if you want to, on the YouTube, Doc, you have a YouTube video,
We do.
which I suggest everybody to go to, and they can do that by going to your website again.
Yep.
And going to YouTube and finding that video.
And we've been on the show a couple of times, and I believe we've posted them onto YouTube as well.
You post them on YouTube too.
Yeah.
You were on with David DePino. David not
Yes, I
with us
have.
anymore, but we're here, and the question is, we find this extremely interesting tonight because he's telling us exactly what a torn meniscus is. He's telling us what an orthopedic physician really does as an orthopedic surgeon. He's more into healing than surgery,
Yep.
if I'm correct.
I am.
And if he has to do surgery, he does it from the ankle to the toes, all the way to the spine. Am I correct, Doc?
That is
So
correct.
you do everything that has to do with the skeletal.
I do.
So it's almost like a skeletal. You can review the whole skeleton of the body.
I'm a skeletologist.
Skeletologist. Okay. Well, that's a new word we got, skeletologist. Okay. Again, Doc, his phone number is 483-4111 at 561. His office is located at 9033 Glades Road, Suite D, Boca Raton. Again, it's 9033 Glades Road. Where is that near? Which one is that near?
West Boca, corner of Lyons and Glades. We're actually above the PNC Bank building.
Okay, he's above the PNC back there on Lyons and Glades. Am I correct?
That's correct.
So he's real close by, and if you call him, I'm sure his secretary or his young lady at front will make an appointment for you. He'll let him know the insurance you have, and if he can take your insurance, he will take it. And if he can't, he'll tell you not to. He'll advise you where to go that does take it.
That's correct.
Doc, again, how many more minutes we have? A few more minutes? Well, we'd like to have you back because you're a very interesting gentleman.
Anytime you want. I love coming on.
And a fantastic doctor.
I
and I
have
might be
fun.
seeing you.
Anytime you want.
Okay, folks.
Anytime you want.
We want to thank you. How much more time I got, Freddie?
10 seconds.
10 seconds. Well, Doc, again, it's a pleasure.
Well,
We
I-
wish you a happy holiday coming
you.
up. And all our friends again, if you're in Passover, happy holiday for Passover. And for our Christian friends, again, happy holiday for Easter.
You bet.
Thank you for joining us. Again, All County Healthcare has brought this to you. Please, if you need any home care needs, call All County Healthcare. 954-717-7027.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.